speaking with nurse practitioner Jean Nelson. She is a principal investigator for One Oak, and she's also an HAE patient advocate and speaking for many pharmaceutical companies. Jean, thank you for taking the time today to talk to us about HAE.
You bet. My pleasure.
I'd like to first start by asking if you could briefly explain what HAE is.
Absolutely. So hereditary angioedema, or HAE, is a condition where a person will have random episodes of swelling. These swelling can occur any area of their body, and it can be very painful and very severe.
What symptoms would a patient see or feel?
Interestingly, every patient experiences HAE a little bit differently. As I said earlier, it can be very random episodes of swelling. It can be your extremities, it can be the genitals, it can be your face, it can be abdominal swelling that's accompanied by severe abdominal pain, sometimes vomiting, and sometimes diarrhea.
And when would a patient expect to see these symptoms to start to appear?
You know, that's different for everyone. Actually, you can start to see HAE symptoms at any time in your life. Most commonly, the symptoms of HAE begin in adolescence, around the age of 10 or so. Unfortunately, it often takes years for the diagnosis to be made. It's oftentimes misdiagnosed as allergy, so it can be a real long road to get the correct diagnosis.
And what type of specialist would you advise a patient who suspects HAE diagnosis to make an appointment with?
I would suggest to see an allergist. Allergists are probably the most educated about HAE. Many providers have never even seen a case of HAE in their life. So an allergist would be the one I would suggest.
Would you be so kind to describe in detail what HAE is?
You bet. HAE, or hereditary angioedema, is a very rare genetic disorder that causes random episodes of swelling. It affects about 1 in 50,000 people globally. That translates into about 6,000 people in the United States. So it's actually a deficiency of C1 esterase inhibitor. So what is that? I always like to describe to my patients, it's the stop sign for swelling. So we have this C1 esterase in our body, and when something happens, maybe some sort of trigger, you go to the dentist. This C1 inhibitor tells the body that you only need to swell so much. But if you're missing that, then the episodes of swelling become very severe. And there's actually a cascade here that I'd like to point out. And this shows the many places that C1 inhibitor are found in our systems. And so if you take away all those stop signs for swelling, you see that there's going to be a problem.
Since it's hereditary, does it come from the mother or the father, or both?
It doesn't matter. It doesn't come from one sex or another. It's an autosomal dominant trait. And so we know that 75% of the time, you'll be able to trace this back to another family member. Maybe it's an uncle, a cousin, your mom, your grandma. Somebody had these rare episodes of swelling they couldn't describe, or these abdominal pain no one ever really understood. Now, 25% of the time, there's a spontaneous mutation, and it just starts with you. The 3 different types of HAE, type 1 is when C1 inhibitor, you don't have enough of it. So the stop signs aren't there. There's not enough. That's 85% of the time. Type 2 is when the C1 inhibitor is not functioning properly. That's 15% of the time. Type 3 is what we now call HAE with normal C1. That's the new name for that. And it's when all the labs come back normal, but you still have these random episodes of swelling. And the only way to truly diagnose that is through genetic testing. It's very frustrating for the patient. It's very frustrating from a provider standpoint as well, because you can't rely on the lab work. But that is a genetic mutation, and we're continuing to learn more and more about HAE with normal C1. So it doesn't really matter what kind of HAE, what type of HAE that you have, the symptoms are going to be the same. There's going to be these random episodes of swelling.
So can we explain a bit more about the symptoms, the location of these swellings, and maybe some triggers that these patients have to manage?
Sure. So one thing I've really learned is that no body part is immune. Anything on the body can swell, and it's excessive swelling. So it can be the extremities, genitalia, facial, abdominal. And what's most serious is if you have what we call laryngeal swelling, which is swelling of your throat, which is clearly a medical emergency that you need to seek treatment for immediately.
And what about some triggers that would initiate these swelling episodes?
Yes, sometimes there's a trigger and sometimes there's not. Common triggers are things like any sort of trauma, such as going to the dentist, any kind of repetitive motion, maybe somebody that's typing all the time, maybe mowing the lawn, cutting somebody's hair in that same
Repetitive
action.
motion.
Yeah, repetitive motion there. Stress, and that can be good stress or bad stress, the stress of a divorce or the stress of Christmas, right? All of those things can be, kind of triggers for us.
Thank you. And if a patient experiences these symptoms, what type of specialist should they be seeking out?
Absolutely, I would see an allergist because oftentimes it's very difficult to get to the diagnosis. One of the things to remember is that when you have these episodes of swelling, epinephrine is not going to work. Antihistamines such as Benadryl is not going to work. A steroid shot is not going to work. And so that's one of the secret to getting to that place of diagnosis with HAE is that all the things that a provider would normally provide to you that would work for swelling doesn't work. And there's also generally no hives with HAE. And so that's an important thing both for a patient and a provider to remember.
So if a patient goes to an allergist who does not specialize in HAE, we'd like to give them a piece of information, something to ask that allergist if they could put an order, a lab order, and please test me for this to help
question.
that conversation.
Yeah, I really like that question because I think we all need to be advocates for ourselves with our medical history. And so there's 3 things that should be drawn. Number 1 would be a C4, a C1 inhibitor protein, and a C1 inhibitor function. Those 3 tests are readily available at any lab. They're not real costly, and that will tell the story right there.
So let's say a patient got those lab results back and it turns out that they did have a form of HAE. What type of treatment is available for them?
Okay, the good news is that now there are many different options. So we have what we call prophylactic treatment, which means we're going to prevent. We're going to do our best to prevent future attacks. And then there's also treatments that are called rescue treatments, and that's when a patient is having an episode of swelling and you need to have a tool in your toolbox to treat that specific swell. And so before 2009, there were very few medications to treat HAE aside from some androgens and fresh frozen plasma. And the good news is now we have options thanks to research.
For a patient who has HAE, and let's say they have an emergency swell, and they're in the emergency room, how can they advocate for themselves so they don't get stuck with steroids and Benadryl, things that don't work?
Yeah, absolutely. Anyone that has a diagnosis of HAE, it's imperative that they walk into the emergency room with the knowledge that they need. One thing I suggest for all my patients is that you carry some sort of card into the emergency room with you, because chances are that emergency room doctor has never seen a case of HAE, and you probably know more than they do. So come into the emergency department saying, I have C1 esterase inhibitor deficiency. That does 2 things. It was going to jog something in their brain that they may have learned back in medical school. It also is going to tell them that you know what you're speaking of. And so then at that point, you can also suggest medications that might be useful. C1 inhibitor replacement, such as Berinert, Cinryze. There's a number of them that can be used. And you can also ask if you suspect you have this, but don't really have the diagnosis, to do some testing, including a C4, C1 inhibitor protein, and C1 function.
Not all hospitals can hang on to big ticket medications, like some of them that just came out for HAE. So if a patient perhaps was in a more rural area that could not carry that certain medication in their pharmacy, is there another way that they could be treated?
Well, sometimes they will use fresh frozen plasma, and all emergency rooms have that. And I would like to believe that as we're learning more and more about hereditary angioedema, that most emergency rooms, at least in a metropolitan area, is going to carry at least one product to use as a rescue medication. And if you do live in a rural area, it's really important to get into those emergency rooms, let them know that you live close by and there's a chance you may be coming by, and so advocate for yourself in that way. See if they can't get at least one product that's potentially going to be life-saving for you.
Is there any HAE support groups that patient can look into?
You know, the one that I like and I suggest to all of my patients is the HAEA, and you can just put that, in your web browser. It's haea.org actually, and it is full of information. You can look at patient stories. It gives a description of the medications that are available and what they do. There's a lot of educational pieces. I think there might even be a resource for, a card that you can carry into the emergency room if you need to. So it's a host of information on the HAEA.
Thank you so much for your time today, Jean. I really appreciate it. Us being in research, we're constantly trying to advocate for HAE patients and new treatments and allowing more patients into these clinical trials. And we just appreciate all of your efforts and everything that you've done for the community so far.
I think it's really important to remember that you want to control HAE and you don't want HAE to control you, which is why the research is so important, because this is such an exciting time. There's more and more drugs that are coming to market, and HAE truly affects the quality of life, and we all deserve to set our bar high for your quality of life. And it's because of that research that we've got all of these medications that are available to us now. And so thank you for all of your work.
Thank you.